Hello, everyone, and welcome to today's session. We are going to commence in the next few minutes. We have a very exciting topic lined up for us, and we look forward to your active engagement. So, karibuni sana. My name is Dr. Ruby Oswere, and I'll be your host or moderator for today. So, perhaps just to kickstart our conversation, I'd like us to engage with a quick question. As you know, today's session is about making mental health a priority as a physician. So the title is Physician Heal Thyself. So I would want us to engage with the poll that you can see on your screen right about now. I'm going to send the link to the chat box for you to engage with the Menti that you can see on your screen. So let's just get some quick responses even as we are waiting for our colleagues to join in so that we can start. So again, karibuni sana. Thank you for everyone who is joining in, everyone who is logging in. We have a really interesting topic today. And the title is Physician Heal Thyself, Making Mental Health a Priority. So I know we've all heard the saying, do as I say, not as I do. So I would just be curious to hear from you, our audience, right? If your patients would mirror your current lifestyle in every way, I mean, what you eat, what you drink, how many hours you sleep, right? How you show up, what would be the state of their health, right? I'm sure we've all had the saying, do as I say, not as I do. So I would be curious to know, if your patients would mirror your current lifestyle in every way. I mean, like they are doing as you do, not as you say, but they're doing as you do. What would that look like? So you can log into Menti or use the link that I've just shared in the chat box, right? And we can see some responses coming in so far. Okay, so will your patients either be pretty healthy and recovering well? Will they be somewhat surviving, or will they be pretty unhealthy and possibly getting worse? So we just want to hear, if your patients would actually do as you do and not just as you say, what would that look like for you? Let's keep the responses coming in. I see we are mostly on the somewhat surviving, but I guess we want more of our patients to get well. So keep the responses coming in. We see, about 4 participants. They're saying their patients would be pretty healthy and recovering well. Happy for you. Love that for you. And we see some 2 participants. Thank you for your honesty. You're like, nah, my patients would be pretty unhealthy and possibly getting worse. So yeah, let's hear your views on the same. And we also would want you to share the link with your friends, with your colleagues, in your work WhatsApp group. As you can see, from the first question we've presented, this is going to be a fun topic. This is going to be a fun discussion, very candid, but also just very interactive in that way. So we really look forward to your responses. So I'm seeing that the vast majority, right, your patients would be somewhat surviving, right? I'm not sure if this qualifies for any roadside research, but it would be an interesting one to delve into, maybe for those who are very curious on matters, health research, and just, reading the room, reading the vibe. But yes, once more, we'll start in about 2 minutes. But in the meantime, let us answer the question on the poll. Do as I say, not as I do. If your patients would mirror your current lifestyle in every single way, right? What would be the current state of their health? So let me once more share the link to answer the question, and we will begin in the next about 2 minutes. Karibuni sana to everyone. We are really happy to have you on board. We're really excited for today's session. I'm sure it will be quite insightful. So share the link, share the link to your work WhatsApp group, share the link to your class WhatsApp group, and let us get ready for a very, very amazing conversation that we have lined up. So karibuni sana once more. My name is Dr. Ruby Oswere, and I'm going to be your host or moderator for today's panel. And we really look forward to having a very, very insightful conversation on this particular topic about, do as I say, or rather, sorry, physician, heal thyself. But for the poll, we just want to hear, if your patients would mirror your current lifestyle, just in every way, how much you sleep, what you eat, everything about you, what would that look like? So I believe we can kickstart now. We have some amazing attendance tonight. So karibuni sana and thank you for making time. I will stop sharing my screen, but we will continue to engage with you, our beloved audience, in the course of the discussion. But for now, allow me to introduce our esteemed speaker, and then we will jump straight into the conversation. So on board today, we have the amazing Dr. Vundi. She's a board certified psychiatrist with a Master of Medicine in Psychiatry from the University of Nairobi and an MBA in Healthcare Management from Strathmore Business School. She's currently the principal corporate psychiatrist at Chiromo Hospital Group. And as such, she is passionate about applying psychiatric principles within the context of the corporate world. She's also a content creator who creates mental health content on her social media through her podcast, the Self-Work Podcast, available on YouTube and all major platforms. Let me just start by mentioning that I am a personal fan. I yes, have listened to your podcast, Doc, and been following you on social media. In fact, I was so excited when I was told that I'm getting to moderate tonight and to just hear from you. And we have such an exciting topic lined up. So allow me to get straight into the conversation. So maybe, Doc, you can say hi to the participants and then we can start. Yeah.
All right. Thank you for that lovely introduction. Good evening, everybody. As I have been introduced, I'm Dr. Caroline Vundi, a psychiatrist and a mental health and wellness enthusiast. I love having conversations about wellness, and the fact that I am having this conversation with my peers, and I'm sure some senior colleagues are even here. I think I've seen one or two, is just for me it's an extra step for me because I usually talk to the general population, as we would call them. But I'm glad to be speaking to fellow medics, and I'm really excited about the conversation.
Yes, yes.
Mm.
Asante sana, Daktari, and we are also happy to have you. We can see you and hear you clearly, and allow me to jump straight in to our conversation. So we have some questions that Doc will guide us through or just help us have a, a conversation about. Then we'll be able to have a feedback session where we'll be able to loop in you, our esteemed audience, into the discussion. Then we'll finish up with a Q&A as well as a special presentation from one of our senior colleagues. So on to the first question, right? If you'll allow me, Doc, let us begin with your own personal experience, right? So in your experience as a medic, also journeying through life with various stressors, do you find it easy to follow the advice that you so easily give to patients, And perhaps what are some of the mindsets that have helped you to shed the false sense of immunity, I would say, that some medics have, whereby they assume that maybe they cannot suffer from the same mental health issues that their patients encounter, or at least maybe not at the same intensity. So just as we've asked the participants to, tell us, if your patients, yani kila kitu nafanya, like when they come to your clinic, they don't follow the doctor's notes. They just mirror your life, eh? Will they be getting better? Will they be getting worse? So we want to hear from you, what does that look like for you? Yeah.
All right. So I'll share. I mean, that's a loaded question, but it's nice because it opens up so many conversations and talking points. So I will begin with first giving my own experience as the doctor who became a patient at some point. Then I will speak about it from the other end of as a psychiatrist who treats medics and what I kind of see. We'll touch on the health-seeking behaviors and the barriers to care, especially to compliance. But let me begin with my own personal experience. And I've shared this a lot on my social media platforms. So it's not something that I don't attach any shame to my lived experience. So most recently, I did experience postpartum, peripartum depression, actually. And it's very interesting when you have a set of symptoms to which you go and see a doctor. And when the doctor tells you something like you're burnt out or you're anxious, you immediately think, what are you talking about? You so that's exactly what was happening to me because for me, I was sure something else was happening. And I was sure I needed a full hemogram and all those other CRP and whatnot. But it was burnout, it was anxiety. And the lovely doctor gave me a prescription of rest. So I went home with that prescription, didn't pass through pharmacy, and I sat with it for a long time. And feelings of, am I weak? My colleagues, some of them are in their third trimester and they're running around doing the same shifts. What is wrong with me that I cannot be able to handle the pressures that I was trained for? Does it make me a less than doctor? And there's always the thought of, what will my colleagues think? What will my boss think when I go back to work? Does everybody think when I get rest for burnout that I'm just somewhere sipping a cocktail by the beach. And when I come back, there is resentment from colleagues. So there was a lot of mental gymnastics that I went through, but luckily I pulled through and um, I was grateful that I took the rest and I got a sense of what my patients experience. Now let me flip the coin and talk about my experience in treating medics in my in psychiatry. So I won't pretend to know what happens and the health-seeking behaviors in other fields, but let me tell you what happens in mental health, especially with medics. So first and foremost, let's touch on health-seeking behavior. What my observations about doctors specifically. Today we are talking about doctors. My observation and how they approach their mental health is first and foremost they delay coming to see us. So we tend to see people who have been brought by their wives by force because the drinking is too much, or they come to us with a letter from the workplace because the drinking is too much, or they are missing work, or too many medical errors. So we tend to see that kind of approach, delay in treatment. And as we know, research has shown very clearly that the later you present with with any mental symptoms, the harder it is for us to, basically the prognosis is poorer. The prognosis is poorer. It takes more time, more medications, more admissions, be it in rehab. So by the time you're coming late. That's my observation. Sometimes as doctors, it comes with, on top of the delaying, there is also a minimizing. So a lot of you voted there. I don't know if anyway, you had asked a question to the doctors for them to vote in terms of like, are they surviving? Are they thriving? And I would wager a lot of you who said surviving, and this is something I do often in my practice. I always ask, what do you mean you're surviving? I'll ask a patient or a doctor, how's your sleep? They say it's fine, it's good enough. Then I ask, how many hours do you sleep? And the answer is always something something that is not the recommended or the ideal. And look, I get it. I know I'm sitting here as a psychiatrist and our hours they tend to be quite strict, and fixed. But for some of us, maybe we're surgeons and we do night calls. I get it. But what I'm saying is sometimes when I look at the overall well-being of the person, the overall well-being, the doctor tends to think they're surviving, but upon probing, they are not really surviving. Then there's almost always with doctors, there's almost always stigma. So I tend to see when doctors come to uh, see us, they even don't want you to write a sick off using the letterhead of a mental hospital. In fact, some will tell you, I just want to see you virtual. You know, some will tell you, I don't want to buy my antidepressants using my insurance because the hospital where I work, that's where I get medication, and I don't want people to know that I'm on antidepressants. So I'll just buy it cash. A lot of stigma, a lot of stigma. So this is why I've talked a lot, but what I want to summarize and say, this is why I'm passionate about having these conversations and giving my own experience. Because if we break down the stigma, I do believe that we will completely begin to change the narrative for doctors as they seek to have a better life.
Amazing, amazing. Thank you so much for that powerful, powerful start to the conversation. I saw a quote somewhere that, people are inspired by your successes or by your achievements, but they connect with your vulnerabilities. And I would say that is one of the aspects that drew me, first of all, to your page, right?
Mm.
And one of the elements that I really appreciate in you bringing out in this conversation, talking about your lived experience and vulnerability is such a powerful tool. So
Mm.
we would want to just, continue on that tangent and just being able to see that when it comes to now uh, medics as patients, right? When it comes to now, as you've said, the stigma around it, and many times, the delayed health-seeking behavior, and just it being a bit of a challenge for us to be on the other side of the consultation room and on the other side of the operating table in some cases. What are some of the reasons why you feel that doctors make such difficult patients, I'm just trying to trying to unpack the psychology there, if I may, What do you think makes us difficult patients? Yeah.
I mean, it's just that false sense of immunity. I don't believe to know completely the answer to that question, but it's a false sense of immunity. So what does that mean? It means that when you've done something for, I mean, when you become a master of something, really you start, your mind somehow processes subconsciously that you are immune to that thing. So it's just that whole ideology of it can't happen to me. But then again, just linked, stigma is a very interesting thing because stigma is always propagated. When you look at children, children don't have stigma. Children don't have shame in saying, I was vomiting yesterday and my mommy took me to the hospital. So stigma is always passed on from one person to another. So am I blaming the older generation? Yes and no. But I'm saying everybody passes down this stigma that if you are depressed, there's a bit of a what do we say? It's a bit of a hush thing. We don't talk about it, or we use words that like Dr. Levy. Um, so these things we hear them and then we just now absorb them. There's also another reason why doctors don't make the best patients for me is that I think we set such high expectations of ourselves, and this is because such high expectations were set on us. We were the top of our class. We were the creme de la creme. Society celebrated our KCSE results. We were carried on our shoulders and projected in the newspapers. Then we went on and we did well. And then now we did our masters on, now we've done a fellowship. So our whole life is on a pedestal, literally. So anything that looks like weakness or a chip on your shoulder, we resist it, even if that thing is getting treatment. So I mean, maybe other people can weigh in, but that's just how I look at it in terms of even our training is very much very military. Do you know the answer? And if you don't, your consultant makes a comment and makes you feel ridiculous. We're not allowed to fail. We are not allowed to show any moment of weakness. So that trickles down because then we start to look at episodes of mental challenges, such as this is another weakness. So, can I really show my consultant that I have postpartum depression? No, let me tough it out, you know? So, it trickles down, I would say. And that's why we really just have to change the narrative so that the generations that are coming after can know that it is okay to acknowledge that I'm not well and I need to get treatment.
Amazing, amazing. Very, very well said, very well spoken. And I really do resonate with the point that you've given about how, well, be it consciously or subconsciously, we are used to winning a lot, you know? And it's not a bad thing in and of itself, but it can definitely be problematic when we reach a situation whereby now you are almost taking it as, so this is the template, this is what has been, hence it is what to expect. And if I fall short of that, either self-imposed or society-imposed standard, then it's not an option. So definitely just trying to deconstruct some of those mindsets can be quite helpful and powerful, as you have mentioned. So moving on to the next question, right? Um, what are some of the ways in which medics can support each other when they identify that a colleague is going through a hard time, you know? And maybe let me especially highlight on the aspect of, we are all peers, and perhaps someone might see a fellow medic, struggling with their mental health. But when you think of advising them, you're like, "Ay, but they'll just tell me, hiya, you know just as
Mm,
much as I do. We were in the same psychiatry class, we were in the same pathology class. What
yes.
are you telling me that I don't already know?" So
Yeah.
you know,
Yeah.
either it's an internal fear that, your advice will be rejected, or
Mm.
perhaps it's something that has actually happened because, we're used to patients believing us because they know that we know more than them.
Yes.
Now, with someone who is on your level, it's
Yeah.
like, well, tutaanza
Mm.
kupimana nguvu, and they used to beat me in biochemistry. What am I telling them?
Yeah.
What would you
Um,
say to that? Yeah.
I have a lot to say about that, about how to uh intervene in a situation where you feel like a colleague is not doing too well. And I think you had a broader question where you were asking, how do we change this? How do we help doctors to become better patients and to approach wellness? So I'll start with the latter. I think we all need a mindset shift in how we approach mental health and wellness. And by the way, mental health and wellness is a lot of things. It's, of course, it's mental wellness. It's also, for instance, financial wellness. It's because we have to touch on the fact that there is no wellness without financial wellness. And in the last couple of years, we've seen a lot of young doctors struggling mentally because their finances are giving them a lot of stress, because again there are very many demands on them from back home. You don't have a job, but people still, we educated you, we took you to medical school. So you're seeing your friend or your colleague going through all these things, right? How do you intervene? I think first, as I said, we need a mindset shift. When you see somebody struggling, everybody who is on this call who is a medic, I want you to, if you ever see somebody struggling mentally, financially, emotionally, just looking disorganized, I want you to imagine that it's the same thing as if you saw your colleague walking around with jaundice. Um, so, and like very, very severe jaundice. So, would you really just say, you know, I don't want to say anything. This is not something or would you say, hey, I mean, are you okay? Have you been checked? So that's how we really just need to switch our minds on in that, because you always see the person who comes to work looking like they were drinking the whole night and they're still not sober. You always see the person we know the face of mental health, is what I'm saying. So whenever the light bulb goes on, don't switch it off by saying, hey, let me just leave it. Always, always go to the next step, which is now what I'll talk about. How can you approach it? Sometimes I know that you may not be the right person to approach this person. So sometimes you can go through a friend of a friend. I mean, this person who is struggling has somebody who is they're close. Maybe bring it up with a friend. Hey, have you talked to your friend? What is happening here? How can we help? If you're a senior colleague, I think that especially the residency programs, we really need to set up. Every residency needs to have like a welfare committee where we assign one of the senior doctors to be just responsible for if there's somebody struggling, they should be the avenue of this is the person who, points people in the direction of now people like us. So let's be proactive and let's stop turning a blind eye when we can clearly see that somebody is suckling down the drain. A culture of openness. So what we are doing now, these talks are brilliant. You've been doing them for, well, let me not say you, but Kemi has been doing them for such a long time. And I really just want to encourage these conversations to continue. Um, and also peer-to-peer support. So, as I've said in the workplace, if you're somebody who has a clinic somewhere or you're working in a hospital, let's always have a wellness champion, somebody who we assign to kind of just be in a position to be an intermediary. Yeah, I think that's as much as far as I would go with that question.
Amazing. Thank you so much for your insights on the same. And as I'm listening to you, I think something that stands out is that you are bringing in the aspect of urgency, because I feel like as medics, we are no stranger to awkward conversations. I mean, people come to us with STDs and we have to talk
Mm.
about it. People come to us with very embarrassing problems and we have to talk
Yeah.
about it. And what drives us in that regard is we're like, you know what, the benefit is worth the cost. I can push
Mm,
through my discomfort and ask you very
yes.
personal questions because I know that there's a
Mm,
pathology that we need to treat. And in my capacity, this vulnerability is important. So I
mm,
really do see just the mindset shift that you're trying to spur us towards in
mm,
regards to, in the same way that if a patient has jaundice, like if someone is walking around with jaundice, even if you don't know them, just as a
mm.
medic, it almost feels wrong for you to
Yeah.
withhold information. It's
Yeah.
like, yo, I will not
Yeah.
let you pass, yet I
Mm,
know that this could
mm,
be a problem. I've seen it. You might not have. And I'm
yeah.
choosing to let you know because I know it will
Mm.
help. So,
Let
yeah,
me also add on to that because I'm just as I'm just thinking, doctors, we are very good to applying the principles of medicine to our patients, but as we are dealing with colleagues who are struggling, I want us to also practice the very same principles of medicine, beneficence. The beneficence, if my memory serves me right, is just actively promoting the welfare of patients and providing treatments that benefits them. So we prioritize decisions that benefit them. You're just always working towards that. Why do we do that for our colleagues? Or do we give the first year residents shifts that just don't make sense? Which I know, of course, first year you have to carry the workload. It's the way that it is so that you can learn. But sometimes it can be there can be a bully behavior. There can be a bully behavior in medicine. Um, a part of it is very important, the toughness and the doing a lot of work but sometimes it can be extreme. So how can we be talking about beneficence to our patients and we're not doing it with our colleagues, even if it's our younger colleagues? Non-maleficence, avoiding harm to patients. Let's also avoid harm to colleagues. When a mother is pregnant and we deny them maternity leave because they are a resident, what are we saying? And we know very, very well what the rates are in postpartum depression amongst colleagues. They are higher than in the general population. That is maleficence. So you're doing to your patient, your colleagues, what you wouldn't do to your patients. So I think I just want to, and lastly, confidentiality, because again, we also have a culture of propagating shame when we know that somebody is dealing with certain issues like alcohol or this and that. We tend to talk about it in a very shameful way. We are gossiping and this and that, but we are very good at being confidential with our patients. Let's apply the very same principles: accountability, accountability, um, professionalism. I think let's treat our colleagues like we would our patients.
Wow, that's really groundbreaking. And I feel like just a change in mindset is so powerful because truth be told, as we've said, doctors can be patients. And sometimes maybe we don't see our fellow doctors as possible patients. I guess just the concept of humanizing each other in the same way that we would desire maybe the rest of the world to humanize us. And in that process, just for us to see that, we are not superhuman, we're actually just super human. And that's so helpful and powerful. So if you'll allow me, I want us to jump into more of an interactive part of our webinar, right? So we want to just encourage peer-to-peer sharing because, there are some people on this call who are younger colleagues like me, just freshly minted off the press of the pass list. But we also have some senior colleagues who've been here a while. And we just want to, have some session on sharing amongst each other. What are some strategies or mindsets that you have personally found useful in maintaining your mental well-being? So we will use the link that I'm sharing to the chat shortly, just that you can use it, for the question. Just a moment. Let me share it. Actually, it's the same link as earlier on in the call, but let me just reshare it, especially because I'm seeing our numbers have increased significantly, which is a lovely thing. Hey, technology. Sorry, guys, just a minute. I'm getting it to you right now. But in the meantime, you can be thinking of your answer, right? So what are some strategies that you have found helpful? There you go. I've sent it. So yes, that's the link for us to answer our question. What are some strategies or mindsets that you have personally found helpful, right, in maintaining your mental well-being? So we just want to hear from you, hear about your lived experience, whether you're a senior colleague, junior colleague. I feel like there's also a role for just reverse mentorship. Oh, I see we already have some responses. Amazing. So we have someone saying exercise, meditation, spirituality, i.e. practicing religion, journaling, amazing, working out, actively being kind to myself. Oh, I love the active word there. You know, it really makes a difference. Just being active with it, active kindness to yourself. Journaling makes another appearance. Exercise, working out daily, and ensuring I have good sleep. I see that exercise is it's a common one and it makes a lot of sense. Exercise, journaling, intentionally taking rest, again with the intentionality, boundaries with work. That's a big one. That's a big one. Boundaries. And I'm really, really keen on what that would look like. Journaling again, mindfulness, positive thoughts daily, having a company with 4 of your friends. Evo, let's explore this. Having a company with 4 of your friends. Meet monthly forever. Allah, do business together. Attend each other's events. May God mercy, you're living a good life. God bless you and your friends. That's amazing. Mentorship, doing monthly counseling sessions to manage my anxiety, dancing, playing with my son. I love that for you. Being intentional with working hours. Again, that is alluding to the point about boundaries and being kind and positive vibes about myself. Love that. Being intentional with my children. Amazing. Running marathons again with the physical activity. Regular exercises every Tuesday and Thursday. Nice. Meeting members of my Rotary group every Monday. Hey, we have a schedule. Wellness Monday to Friday. Enough sleep. Beautiful. Disconnecting from hospital conversations with fellow doctors. Ooh. Wow. Is that part of boundaries with work? I love it. Thank you so much. Mentorship, beautiful. Exercise, resting, amazing. TikTok, imagine it's valid. It's so valid, guys. It's valid. Relaxation techniques, setting practical goals, financial literacy, discipline, praying, amazing. And just to highlight on how Doc, you were sharing earlier just how that the financial health is quite important. Exercise, taking scheduled day off per week, not involved in medical issues. Seeking legal redress when dealing with bullies. Wow. Talk about being active, with just taking agency and being able to stand up for yourself in that way. Creating time to talk with my family and my best friend at least twice a week. Nice quality time, working out with my colleagues. Thank you for everyone who is like being very, really specific with it. It's like I do this on Monday, I do this on Tuesday, so that we see even what it looks like on a day-to-day. Self-awareness, beautiful. Praying, amazing. Think about myself on a weekly basis and giving myself a healthy treat weekly. Wow. Can a treat be healthy? It can, guys. It can. Taking breaks, working out, spirituality, social connection, having boundaries on work hours, not comparing with others. Powerful, powerful. Setting and enforcing boundaries with work, i.e., not receiving work-related calls or emails after work hours. Amazing. Walking in the sun daily. Some vitamin D. Makes sense, eh? Traveling and putting off the phone. Religiosity, spending time with family, spending time with non-medic friends. Interesting. Helping out the poor. Beautiful. On my days off, I switch off my phone. Rest is unparalleled. Mashallah, love that for you. That uninterrupted peace and sleep is everything. Amazing. Doc, maybe can you give some comments on the strategies given so far? Anything that stands out for you?
No, they're all very interesting, and I hope the person who says TikTok, I hope you are following me. So because I have to shamelessly plug myself, but everything that has been mentioned, I co-sign. But I also want to say, if you've tried all these strategies, but you still feel mentally you're not okay, you've even tried therapy is not working. I want to say that it's okay if your serotonin is bought. So what do I mean? It's okay. All these things that we are doing for, journaling and exercise, it's to boost our, in a very simplistic way, serotonin levels. But some people genuinely have seasons in life when you need medication. And I know people think psychiatrists just want to medicate you for life. um I just want to debunk that myth here, and I can see a lot of my colleagues are on the call. That reputation really needs to we really need to lose that reputation. But life has seasons where sometimes truly this is what you need. And if really medication is what you need, it's okay. I'm here to say that it's okay. And then when you're better, you get off the medication if that's the indication. So all those things are wonderful and great, but for some people, it's even the exercise, even the journaling is not working. Go see your doctor, go see your psychiatrist. And when they slip you a prescription, we are breaking down those barriers. If you need it, just take the medication.
Incredible. Thank you so much for that very, very important addition to our conversation. So perhaps in the interest of time, right, I would want us to answer some of the questions that have come in the chat box so far. We can just get into some of the questions, and then now at the very tail end, we will hear from one of our senior colleagues about this very same topic. So we have someone who is saying, thanks for the conversation. I went through postpartum psychosis during COVID times, and I appreciate the team who supported me, still managing my anxiety through my residency. Though counseling sessions are expensive, I have missed a number of sessions, and my hubby struggles with alcoholism. He's a resident too, but in denial. Okay, okay. First of all, just want to uh, honor and acknowledge that this is a very safe space. So thank you for sharing. We see you and we hear you. And maybe, Doc, you can give some insights on this particular question that has come in. Yeah.
I mean, first of all, the idea of having an anonymous chat is brilliant. So well done, Ruby and the team. So postpartum issues are so prevalent, especially in the amongst medics. So I really want to urge anybody here, any medic who preconception, if you are just thinking of having a child and you're a medic, just start therapy. Just start therapy preemptively. But thank you so much for that. Now she's mentioned her husband who is a resident and is an alcoholic and is in denial. A very nice cocktail, which we see very commonly. Men tend to lean towards such coping mechanisms as drugs and alcoholism. So, what can you do? I'm sure you've tried this. I tend to advocate for having safe interventions. Interventions have a very nasty reputation whereby you kind of just ambush the person with a bunch of people the person walks in and there are 10 people in their sitting room and they're telling him, there's a van outside, you're getting in and you're going to Madare. So I recommend for a safe intervention where, yes, you have a very close, group of either family close to the person, not close to you. So close to the person who is struggling and preferably a mental health professional there, even if it's a psychiatrist. And at the point of the intervention ending, there needs to be a plan. So we didn't just come to chit chat, there is a plan. Yeah, but we give the person time to process. But it's a journey. I'm not coming here with a miracle answer. The journey to getting somebody who is in addiction into care takes long. And guess what? The journey after, the aftercare is even longer because we do know that rehab alone, it has a relapse rate of is almost 70% after the first time. So what we are saying is that we just have to continue, keep pushing the person, keep trying. Rehab didn't work. Let's try this. Let's do this. Let's do that. But we don't give up on the ones we love and we don't give up on medics. However, supporting a loved one who is an alcoholic is difficult and it takes a toll. So for your own sake, also have a therapist, also have a support system, a net to fall on because it's difficult. I don't know if I should proceed to the next question or you have a comment, Ruby.
Yes, yes. Thank you so much for just being very clear and compassionate, really, with that answer. So thank you so much. We can move on to the next question. And actually, the next two are somewhat related. So someone is saying, many residents struggle, wish we could integrate it with mental care to help the situation. And another attendee, also sharing anonymously, is asking, how can you manage residency-related stress?
Mm.
Let me even add my own question to this. As I said, as one who has been freshly minted off the press of the pass list, you know, um, internship, internship related stress. I feel like internship, residency, those are really the hottest part of the flame. You know, it's the core of what can really push you to the limit when it comes to your mental health, you know, as a pre-intern, right? And we are planning for the KMA internship conference later in December. So we just want to hear, you know, residency, internship, these very, very difficult seasons. They are seasons, they do pass, but they're tough. So what can you say to residents and interns on just managing their mental health in that very tough season? Yeah.
Oh my, this now just has to be a whole other webinar. This has to be a whole other webinar. But I would say step one is, so we can do macro things we can do on the macro level and micro. So micro level are individually, like as an individual, what can you do to deal with the stress of residency? I'll say definitely get help. Contact a mental health professional, a therapist, a psychiatrist, walk that journey with them. I believe we had a KMA something Tufunguke campaign. Somebody has even commented that in the larger chat. but just seek professional help first and foremost. Number two, it's okay to take breaks. As I said, sometimes we can be so caught up in let me finish, let me finish. Sometimes it's okay to take a gap here. If your program allows it, sometimes it's okay to take a gap here. Please come. We will write you events supporting documents. If truly your mental health is struggling and you need to take some breaks, take the breaks. So and lastly, I would also say that doctors, we are learning slowly how to live. So as you do residency, please remember to live a little. I know you may not have time, but live a little, live a little. Life is not just about that. Find something that gives you, you know, that gives you joy. On a macro level, we need to have changes done. And I don't think I'm the person to talk about this, but something needs to be done about how much residents are working, um, how are they supposed to earn as they are, this is something that needs to be done on a level where I am not at, but changes need to be done. The bullying needs to end. Um, yeah, yeah. I think that's a larger conversation. Maybe some of my senior colleagues can comment on that.
Thank you. Thank you so much for that. And speaking of senior colleagues, we are about to hear from one very, very experienced, right, senior colleague on this very important topic. But before we usher him in, I'll read the last one for now. So someone is saying, not much of a question. My husband suffered from depression while in his med surgery. He died by suicide. I'm really sorry. Alcoholism, hopelessness, it was a real struggle. Care was problematic when he was not drunk. He was amazing. And that was when he went to see the psychiatrist. They often laughed, no meds. I struggled adjusting, but got help and adjusted aftercare. Thank you for what you do. So just sending flowers, to you, Dr. Bundi, and the members of the fraternity who are really committed towards helping us out as psychiatrists. So I will now allow our KMA president, Dr. Simon Kigundu, to introduce a very esteemed senior colleague, that is Dr. Alwoch, to be able to give a brief presentation on this very important topic. So perhaps Dr. Kigundu, I'll allow you, all protocols observed, to be able to introduce Dr. Alwoch for the next few minutes so that he can tell us more on this topic and what amazing work that he has done when it comes to discussing about, physician heal thyself. Yes, karibu sana. You can unmute Daktari. Yes.
Thank you. Thank you very much. The team that has organized this very informative webinar, and I think we probably need more and more of these talks. As you are aware, we have in our midst Dr. Joa Loach. Dr. Joa Loach is an 81-year-old doctor, is still in active practice, but his CV is like 50 pages. And part of those 50 pages include some of the writings he has done on various topics, the latest ones being of artificial intelligence. When this topic was put out, he has given a talk previously on physician well-being and physician heal thyself. Ruby, I don't know whether you have the small PowerPoint that I shared, but we want him to give us a small, maybe 2 minutes, 3 minutes, wise words on the same topic. And I think it touches a lot on what Dr. Bundi has actually mentioned. Dr. Loach, you have a few minutes. Tell us something, and we will circulate your PowerPoint to the team.
Thank you, Dr. Kigondi. Can you hear me loud and clear?
You're audible. You're very audible.
Thank you. Actually, I'm very interested in hearing what the young doctors have been talking about mental health and this physician heal thyself. My interest has been about the doctors in health in general, and with particular reference to ability to practice the medicine under the health condition. But there are a few things that we must right from the beginning. First of all, the issues that make a little doctors a bit problematic sometimes is that because their education, they put themselves as having high education academic level, so put themselves in high social status, which requires that you behave according to that standard. And this is what sometimes make people and making the themselves believe that they're special human beings, so who should behave differently. But at the end of the day, they're not a special human being. And I'm sure most doctors, if you prick them, they'll feel pain and they will also bleed, just like anybody on the street. So they're not very special human beings. They're not saints at all. But unfortunately, sometimes they try to regard themselves as well. And then there's this notion that doctors treat people, but it's a very stupid thing, but they feel that doctors should not be sick. They should always be always healthy and never have any medical problem. And if they do have any medical problem, there's always a conspiracy of silence about the sickness, either from the family, from the staff, or from the colleagues. And they find it difficult to reverse the role of a doctor to become a patient, because since they're supposed to be immune for sickness. And most of you must have gone to school, so you must have read this book called Dr. Jenkins and Mr. White. And that is what happens a lot of them. So doctors are always afraid to appear weak or sick. Although after having worked, I'm not going to present this, before you take this, it's a long lecture. The doctors will take a long time to accept that they're sick, and if they so, they'll minimize their sickness, they conceal it, or even deny it altogether because they want to be very strong and remain strong and intact. But over the years, more and more doctors take to alcohol. And before most of you were born, during my time, the biggest killer of doctors was alcohol. And I can mention you our top 10 specialists in these countries in all field, physician, surgeon, ward, that actually died from directly from alcohol or indirectly because of alcohol, having accident or other things. So alcohol was the biggest killer. The medicine was given for that, some of which are not genuine, imaginary, but they did work because the doctors died eventually from those cases. But most doctors like to remain strong and incurable. Lately, before when I was young, there were virtually no female doctors. Every doctor was male. But nowadays, there are even more and more female doctors. And I've been told that more female doctors are taking to alcohol and more male doctors are taking to drugs as a result of some of their frustration. What I've never understood is that a lot of doctors have complained of burn syndrome. Yet there are 100 times more than when we were on the patient with the seeing in a day, more of the same. As doctors, you do internship, you do the daytime, you work in the ward. At night, you work in the emergency department or in the labor ward. You may go only for 2 or 3 hours on a few hours sleep. So I think burn down syndrome, as I saw the young lady talking about, should not be a major problem or a major psychological problem. And as Dr. Godu says, I'm interested in digital medicine. With digital medicine, a lot of things that we had to do before can now be done by machines. With artificial intelligence, the less and less most machines, even in ICU, can be controlled by artificial intelligence. So you don't have to work all the time. In fact, there are a lot of things that doctors used to do that can now be done by a machine. And we should not have that big problem. But the main problem is that doctors hide. They like so-called corridor consultation, where they're walking on the corridor, maybe they've got a pain here, or they like a prescription, oral prescription on the corridors. And worse still, some of them make their own diagnosis and prescribe themselves. Now, this has happened, that happens to doctors all the world. I don't know how we'll ever get them out of the doctors, but it causes a lot of problems. And that is one of the reasons that delay coming to sickness. And let's face it, if you're a doctor, you have to be pretty smart. I mean, which doctor would like to be diagnosed mental illness? Because you know that's the end of your work. If you're mentally unstable, you're not able to treat anybody or do anything else. That's why some of them have to wait until it's beyond reasonable help that they come and they wake. And even when they're diagnosed as mentally sick, and I know I've several and I've treated over the years, they're very poor at taking medicine. So the constitution of doctors hiding away and from their sickness will remain for a long time. And the idea of physician, he thyself, will be something we have to live over the years. I should never remember the Jesus and St. Luke's. But as I said, this is a topic I've given lectures several times, and it's difficult to do it in 5 minutes. And the Kikondo told me 2 minutes. I think I've done a little more than 2 minutes. Thank you very much for the opportunity.
Thank you very much, Dr. Loach. Always very nice to listen to you. Back to you, Dr. Ruby.
Thank you so much, Dr. Alwoj. I saw a quote somewhere that one of the benefits of having more experience is that you're just able to be a lot more efficient, you know? And I really, really want to thank Dr. Alwoj for your very brief, but I must say very powerful explanation on the topic. And as you've said, you know, you can do a 3-day, you know, workshop on this, but you can also, you know, really just condense it into 3 minutes. And that's part of just the skill that you have learned over time in being able to communicate to us as doctors. And we are very, very inspired by you and your work and your role. And we really, really do appreciate that. In an aim to honor our time, right? So as to have those amazing boundaries that we had spoken of, right? Between work and life, we really kindly beg to end our conversation there. However, we will pick it up next week, same time, same place, with another amazing topic about mental health. So I want to hand it over to Dr. Wanjiko to give a vote of thanks, right, on behalf of the team, and just to be able to wrap up our discussion for today. Asanteni sana for everyone who has turned up for our discussion. And let me now hand it over to Dr. Wanjiko, who will now give a final vote of thanks. Yes, karibu sana, Daktari.
Thank you, Dr. Ruby Oswere, for an amazing moderation. Amazing, amazing work, Dr. Caroline Vundi. I must We were actually classmates in undergraduate, and it's amazing to see how she has blossomed into her area of expertise as a consultant psychiatrist. And I know that she's now majoring on women's psychiatry. So that is really amazing. It would also be very nice to have gynecologists work very closely with her, because she is majoring on menopause, postpartum depression, anxiety around puberty, and just anything to do with women's psychiatry. Thank you very much, Dr. Joe Aluoch, our senior. Always a pleasure to hear from you. Thank you for those nuggets. I will be sure to share all your presentation to the rest of the people through the KMA. The KMA ICT officer will be able to email everybody who was able to log in tonight. Otherwise, thank you very much, our president, Dr. Simon Kigondo. I think he has attended every single one of these Wednesday evening webinars. We are really, really grateful. And so we meet again next week on Wednesday, 7 p.m. We are still continuing with this series. It will be a 3-month series. We started on the 3rd of October. So we've done a whole month of this every single Wednesday at 7 p.m. We are calling it the Mental Health Series of Webinars, brought to you by KMA Physician Wellbeing Committee, where I sit as the committee's convener. Otherwise, your CPD points will be automatically generated through your ICPD portal, because you were able to log in, and I hope you logged in using your license practicing number, so you will be able to get your CPD points through that way. Otherwise, from me, it is a big, big thank you for joining us, and do have a lovely Wednesday. Continue to make self-care and mental health a priority. Until next week, it's a bye-bye from me. Good night.